Hello everyone, welcome back to my channel. This is Dr. Zina speaking. You have selected this video because you want to learn about the anatomy of the maxilla. So before we continue, make sure to smash the subscribe button down below because it would really help me to do more and more videos. So let's start now. The maxilla, which is also known as the upper jaw, it is a vital viscerocranial structure of the skull. It is involved in the formation of the orbit, your eyes, nose, and palate, holds the upper teeth, and plays an important role for mastication and communication. And it is unlike the mandible, where it is not mobile. The maxilla consists of the body and its four projections. The four projections are as the following: frontal process, zygomatic process, palatine process, and lastly alveolar process. In order to remember it, I created for you a mnemonic to easily remember it. That is, from zoo, I pick anaconda. Here are the four processes of the maxilla, or the projections of the maxilla. Frontal process, the top one, then zygomatic process, then palatine process, and lastly alveolar process. As you can see, the body of the maxilla is the largest part of the bone and shaped like a pyramid. You can see the green color. This is all referred to as the body of the maxilla. So it is the largest and it is shaped just like the pyramids of Egypt. The alveolar process is an inferior extension of the maxilla, so it is not like the frontal process where it's located superior. It is located down, so inferior, with a rather porous structure. Now, what do I mean by porous? Porous means it is a structure that is filled with holes. Just like the sponge, how it is filled with holes, similar to the alveolar process. Alveolar process is just like a sponge that is filled with holes, and these holes, they contain 8 cavities where the upper teeth are held. 1, 2, 3, etc. Where the upper teeth are held, similar to the sponge. So a tip to remember: alveolar process, as the name suggests, equal to alveolar bone, which will hold the teeth in place. The second process that is located superior, not inferior, which is the frontal process, which has a vertical ridge. As you can see in the picture, the red color is the ridge. So this is the vertical ridge, which constitutes the medial border of the orbit. Anterior lacrimal crest, located anteriorly. So anterior to the ear is anterior lacrimal crest. Posteriorly, it forms the lacrimal groove. Backside, you can see it forms the lacrimal groove together with the lacrimal bone. Superior-medially, it is in close contact with the anterior ethmoidal sinus. So a tip to remember: frontal, meaning that in front of your eyes, which is equal to just next to your eyes is your frontal process, which has lacrimal bone. So frontal process, it forms what posteriorly? It forms the lacrimal bone together with what? Lacrimal groove. So the lacrimal groove together with the frontal process, they form the lacrimal bone at the end. So whenever you hear the word frontal, remember your eyes. Frontal equal to lacrimal bone, in front of your eyes, next to your eyes. The zygomatic process of the maxilla grows laterally. As you can see, the yellow area is the zygomatic process, and it meets with the zygomatic bone. As the name suggests, zygomatic process equal to zygomatic bone. So it grows laterally on your face. Where exactly? On your cheeks, just below your eyes, is the zygomatic process. Lastly is the palatine process, which is a horizontal extension on the medial side of the bone, constituting the roof of the mouth and the floor of the nasal cavity. Together with the palatine bone, it forms the hard palate. Anteriorly, it features a small process that is the anterior nasal spine. The incisive foramen can be found on the medial line just posterior to the incisor teeth, where the nasopalatine nerve and greater palatine vessels they pass through the incisive foramen. And I will show you a picture in a couple of seconds. The location of the incisive foramen. So as the name suggests, palatine process is equal to palatine bone. Palatine bone is equal to hard palate. So you're the structure on your hard palate. So your hard palate is equal to palatine process. Remember, hard palate equal to palatine process. Because the palatine process with the palatine bone, it forms the hard palate. So in conclusion, it is your hard palate. Here is the picture for the incisive foramen. Foramen, just like what I said previously, it is an opening. Opening for what? For neurovascular structures to pass through. Which structures? Nasopalatine nerve, the greater palatine vessels. They all pass from the incisive foramen, in which they will supply the upper anterior teeth. So the upper anterior teeth are being supplied by the nasopalatine nerve and greater palatine vessels, all of these via the incisive foramen, by the help of your incisive foramen.